So it has been about a month since I filmed that last clip that you guys have just seen, and I still haven't managed to get anything uploaded to YouTube with an update on how our IVF cycle went. In the last clip I was telling you about my IVF egg retrieval and how that all went, and that we were hopefully going to be proceeding to a 3-day transfer that weekend. So that did happen. We headed up to Perth on Saturday the 26th of May and had a 3-day embryo put back in, a great quality one. And we managed to get 5 other great quality embryos to freeze from that round of IVF, which was so amazing, and basically our main goal for that whole round of IVF. So yeah, that round of IVF was the best by far, and actually such a good success. So we were really thankful for that. The day of my embryo transfer, I hadn't been feeling too well. I suffer from gastritis, which is a stomach condition where the lining of my stomach is a bit inflamed, and I've suffered from it on and off for the last fair few years, and sort of it flares up at times and then gets better. And that day I was feeling particularly sore. My stomach was really hurting, so much so that when we came back from the embryo transfer and picked Harris up, I said to Sarah, I really need to go to bed and go lay down. We had a comedy festival that night. That was a gift that Sarah got me for my Mother's Day. And so I was going to rest up for most of the day and then go there that night. I really didn't feel much better as the day went on, but I took some strong painkillers, and yeah, I really didn't want to do that. You know, the day of the embryo transfer, I really wanted to be as well as possible and to not put anything in my body that I didn't need to. And the painkillers that I used were safe in pregnancy, but they were still strong painkillers. But I just was in so much pain that day. My stomach was so sore, and I just really couldn't cope with it without painkillers. So I had been really disappointed, that I'd gotten ill then, and that soon after my embryo transfer I was having all these issues and feeling so unwell, and really worried about how that would bode for the embryo implantation. And I just kept trying to make myself feel better by reminding myself that the embryo wouldn't have been implanted yet or for a fair few days. So, I just needed to get myself better and feel well again, and hopefully it wouldn't affect the embryo because it would just be tucked up nicely in my uterus, and there, like I said, wouldn't have even implanted as of yet. So we struggled through the next couple of days, and I really didn't feel much better. Normally when my stomach gets sore, it will sort of flare up, and then as long as I'm really careful about what I eat and I rest up and just give it a bit of time, it normally resolves itself and it's fine. I take some PPIs, I take Nexium, and that normally helps enough that it will relieve my symptoms, and I feel fine. But that just wasn't happening, and every day the pain would get worse and worse. In the mornings, it would be bad, but I'd soldier on. I'd take Harris to daycare, I'd go to work, and then I'd come home and I'd go to bed, and I'd take a ton of painkillers, and I'd be up all night just trying to manage the pain and do the whole thing again the next day. And it got to about Tuesday. So yeah, embryo transfer Saturday, and it got to about Tuesday, and I was just devastated that I felt so ill following this embryo transfer, and that I really hadn't given this little embryo the best chance, and that I was in so much pain and so unwell. And that morning I dropped Harris off at my sister-in-law's, and she is a nurse, and she basically just said to me, if you are having this much pain, then you need to go to the hospital. I had actually booked an appointment with my GP for later that week, the first appointment that I could get, and I was kind of just hanging out till then. That's what I was waiting for. But she insisted that no, I needed to go to the hospital and I just needed to get completely checked over and just make sure that it wasn't something more serious. So that day at work, I kind of felt okay, and I hadn't really been eating very much because it would just be worse when I would eat. But at lunchtime I was really hungry and I actually ate a little bit of lunch, and straight afterwards I was in so much pain that I just thought, this is ridiculous. And rather than take more painkillers and just try and manage for the day, I rang Sarah and told her that I was just gonna go to the emergency department and just get checked and make sure everything was fine. So I did that, and I got there and I felt so stupid going to the emergency department with what I felt like wasn't really an emergency. I was in pain, but it was a pain that I'd been coping with myself for the last few days, and something that I dealt with, for the last couple of years on and off. The only difference this time was that it was lasting such a long time. Normally I would feel heaps better within 24 to 48 hours, and this was like sort of 3 and 4 days later, and I was still feeling the same way. So that was the main thing that made me think that this was worse. And the doctors in the hospital actually did a full check over and told me that I had pancreatitis, and that my pancreas and my liver were both extremely swollen, not working properly, and that I needed to go for a scan to try and figure out what the problem was. And I had an ultrasound done a couple of hours later, and they diagnosed me with gallstones. So basically my gallbladder obviously hasn't been working very well for the last few years, and I've been suffering from gall attacks, and I've just assumed that it was the stomach issue that I've been suffering from in the past. So yeah, I did feel a little bit stupid that this has been going on for years and I've just been dealing with it, and there really was something seriously wrong. So yeah, I have gallstones, and one of the stones, obviously this time, had been pushed out of the gallbladder and was stuck in my bile duct, which had given me pancreatitis and infected my pancreas basically. So that meant a lovely 4-day stay in hospital in the surgical ward to be on IV antibiotics and fluids, and just to try and monitor how my condition was. It was really awkward trying to explain to all the hospital staff that I wasn't exactly pregnant, but I wasn't exactly not, and that we had to treat me as if I was pregnant, but there was a possibility that I wasn't. Yeah, they were all very confused. None of them really knew that much about IVF or embryo transfers, and yeah, I was left to just explain myself over and over. But yeah, it wasn't a very nice time. Like, spending time away from Harris was just horrible, and Sarah had to drop everything, including work, to stay home and look after him and look after me. And obviously I was gutted that this happened when it did. That little embryo that we put back was having to fight through all this to possibly implant, and the surgeons at the hospital were basically being forced to wait and see what happened with the pregnancy test before they could make a plan for surgery to remove my gallbladder. So they released me after about 4 days and basically said that I should go home, I should have the pregnancy test with the clinic, my beta, as a normal, and they gave me an appointment, an outpatient's appointment, to go and see the surgeon once I knew what the results of that were going to be. So yeah, I came home and Sarah and I tested later the next week. I think we tested at we tested the next week, the day before my actual blood test. I can't remember how many days past transfer it was, and the test unfortunately was negative. I was not in the least surprised. I don't think that there was any possible way that any little embryo could have fought through all of that stress, all of those medications, and just all that pain that my body was in. The timing absolutely sucked. I felt like we just finally gotten some good luck, having such a great IVF cycle, and then it all went to crap again, and I couldn't help but blame myself for that. You know, my body had failed me, and I had failed me because I should have realized before that, you know, that how I was feeling wasn't normal and it wasn't okay, and gone to have myself checked out. But yeah, I didn't, and that's what happened. So I've since had an appointment with the surgeon and set a date to have my gallbladder removed, hopefully laparoscopically, so I won't have to be opened up, which should have a pretty short recovery time. That is going to be happening on the 31st of July, and I can't wait. Until then, basically the advice has been to eat very small portions, to eat as low fat a diet as I can humanly manage. If I have too much fat in my diet, then it could trigger another gallstone attack, and could put me back in hospital and mean that I'd have to have emergency open surgery, which I don't want. So I have been eating almost nothing and so healthy since I was released from hospital. I did say that I wanted to lose some weight, so this has been the best kickstart to diet. I've actually lost about 7 kilos in 3 weeks, so just over a stone, which is pretty amazing. It's a little bit frustrating that we're gonna have to wait a little while before putting one of our frozen embryos back. I'm so frustrated with all the waiting that comes with this journey. I feel like it's crazy that we started basically, you know, coming up to a year ago, and we're still not pregnant, and I'm still having to wait before we can try again. You know, I think that's the most frustrating part of all of this, the waiting. But we are so lucky that we have some embryos to put back this time, and that is the challenge that we're facing, is just to wait, not that we need to go through this all again, or that, you know, we're really lucky to be in the position that we're in. So I will deal with my frustration, and yeah, I'll just take it from here. Hopefully I might be able to do another transfer in August, we'll see. Given that my surgery is the 31st of July, it would be quite close, because I'll probably need to go in mid-August, so it would only really be 2 weeks after my surgery, which I'm not sure if my clinic will allow, but if not, then it will be September. But I will try my best to keep you guys updated better, and to let you know how we're going with this journey. But for now, I'm doing a lot better, I'm doing great, and I'm actually feeling really good. And yeah, like, we haven't given up hope. I really hope that I'll be pregnant by the end of this year, and I can't wait to take you guys along on that journey too. Okay, thanks for watching. Bye.